because it's 1:00. Good afternoon, everyone, and welcome to the Aging and Long-Term Services Department Universal Consumer Information Tool Training, Session 2. My name is Denise King. I'm the Aging Network Division Director here at the department, and I want to thank you for logging in. This is an important second part to our training. We're building upon our Universal Consumer Information Tool training. I'm going to pause right there because, Courtney, we have your screen, your main screen shared.
Oh, shoot. Okay. Sorry.
With me today, I also have Courtney Hoskins, who's our ALTSD contractor. Also with us is Miriam Morehouse. She's our Aging and Long-Term Services Department Program and Fiscal Data Manager. I want to thank you for being patient. We did make a change to the training to make it a Zoom webinar. We were having significant issues with Teams given the amount of people attending the last session, which shows success. It shows some good progress for the network attending these trainings. So we did move it to a webinar. This is being recorded, and we will share that recording with you once we're able to upload that to either a YouTube video or onto our website. Just a few housekeeping items that I'd like to go over. This is also going to be circulated as a PowerPoint resource, so that will also be emailed to you. We also have turned on the live caption, so you can click on that to select language and speech and turn on that live caption. We also have ASL interpreters with us that will be spotlighted on for all participants. We've also added in a self-care break to our session today, as we were made aware that the 2-hour training was a bit long and there needed to be a break built in. So we've added that to this session. Next slide. Just to go over today's agenda. Again, I want to welcome you to the second session of our Universal Consumer Information Tool Training. And thank you for joining today and taking the time to build this into your schedule. It is important that you're attending all the sessions, and we will go over that agenda at the end of today's presentation. We are excited that you are actively engaging with the session today, as well as implementing the tool moving forward. As you heard last session, this tool will be utilized starting October 1st for all Title III service providers. On this slide, you will see at the top, moving forward through the slide deck, you will see on the corner of the slide deck some icons. These icons will be of assistance to indicate if we're watching a video, if we're going to be taking a poll, paying close attention, or resources that will be linked. And we will remind you about those during the session as well. By the end of today's training, you will have a solid understanding of the definitions of services and other important terms, as well as reporting requirements for demographics and consumer characteristics, including nutrition screening. Finally, today, we also are going to give give you an opportunity for a interactive learning part to this session, which means we won't have breakout sessions. We have a large group, and it would be too chaotic to have breakout sessions, but we're going to allow for you to take part of answering some of not only our poll questions, but also doing a group assessment of a scenario that we have built into today's session. So you will be asked to participate in the Q&A. On the bottom of your screen, there's a Q&A button. You're urged to participate in that way. The chat feature for this webinar does not allow for all participants to see what you're putting in the chat. So you're urged to put in your comments in the Q&A. We will also be circulating at the end of the training in September an FAQ, a frequently asked question, as part of the tool training. At this time, I'm going to go ahead and turn it over to Miriam Morehouse.
Good afternoon, everyone, and welcome to our second training. I'm going to briefly review what we discussed last time and what happens to the data when you turn it in. So we're using a new tool, the Universal Consumer Information Tool, that will collect the same data across the state. And everybody, this way we will be able to have a better analysis of our data. And this is going to start with each provider. So I want to thank each provider for being diligent in entering the data correctly. And after the provider, it goes to the AAA, and then it goes to our State Unit on Aging, ALTSD. What happens to this data? This aggregate data is used in the following reports: the ALTSD strategic plan, the quarterly report, which has performance measures that are given to DFA and LFC, the state plan on aging, which we're currently working on the 2025 state plan on aging, and governor requests. But annually, this data also goes to OAPS. It's aggregate data only, and the AAAs review the data prior to them submitting the data to the State Unit on Aging, and then we review it and submit it to the federal government for the ACL submission. And again, as I said last time, I'm a lucky person that gets to push the button so this data is entered to the feds. Then the federal government usually comes back with some questions or analysis that we need to make. And it's very important to have this data as accurate as possible because it determines the funding level at both the state and federal level. Thank you, Courtney. I believe you're the next slide.
All right. Welcome, everyone. So glad that you're here with us again today. We developed this slide just as a culmination of a lot of the really wonderful ideas and poignant words and phrases that you shared with us during our training on August 7th. So I thought that this was a really great way just to be able to summarize the key takeaways from our first training. So that's what this is. And so I'm going to start off our training today talking about services and definitions. If you remember, we talked a lot about the rules and the whys last time. So this time we're going to do a deep dive into services and their definitions and what data is collected for those services. I also want you to know that it is expected that the Universal Consumer Information Tool will be done face-to-face with the consumers. So you can see here on this slide that this is what we're going to talk about. So let's dive into some of the different terminology related to services. So you can see here on this slide that it says Title III clusters. So we're going to specifically talk about clusters. So I just want you to think about clusters as when reporting the Older Americans Act services, cluster simply means the level of information that is needed to be collected for that type of service. So when we go into cluster one, these are registered services. And these registered services include personal care, which is not a service provided in New Mexico, but it's in that menu of services that ACL has defined. Homemaker, chore services, home delivered meals, homemaker services, chore services, adult daycare, and case management. So one thing I want to share with you about these cluster one services is that the nutrition screen, the nutrition assessment must be conducted for each client receiving any of those cluster one services that you see on the screen that I talked about. You will also hear us talk about today the different demographic and client characteristic data. So demographic data is age, gender, minority status, those type of things, where someone lives. So client characteristic data is specifically centered around the nutrition assessment, the activities of daily living, the instrumental activities of daily living, or IADLs. Other level of data that we have within the Universal Consumer Information Tool being the emergency preparedness information. So you'll see a large array of consumer characteristic data too. Okay. So for cluster one services, the specific demographic data that needs to be collected for all of these services, so personal care, homemaker, chore, home delivered, adult daycare health, and case management, is every client will need to report their age, their gender, the geographic distribution, so where they live, like through their zip code, poverty status, household status, their ethnicity and race, their minority status, okay? And then we get into the client characteristic, which, like I mentioned, the nutrition screen, and also activities of daily living, which are lovingly referred to as ADLs, and instrumental activities of daily living, which are IADLs. Right. Moving on to the definitions for our cluster one services. I am not going to read these definitions to you, as you will be able to use this slide deck as a resource tool. What we wanted to be able to do was make sure that you had in front of you the definitions for all of the services. Okay. So, like Denise said at the beginning, we are going to provide the slide deck to you after the presentation is over. So on this slide, you'll see that these are the definitions for personal care, homemaker, chore, And then when I move to the next slide, you'll see that these are the definitions for home delivered meals, adult daycare, health, and case management. So I did not include the entire definition of case management here, as it would have taken up, I think, 2 more whole slides. This is the gist of what is on here. The full definition of case management can be found in Appendix A on OAPS or within the Older Americans Act. So let's move into Cluster 3 or Title 3 Cluster 2 services. Title 3 Cluster 2 services. So as you can see on this slide, Cluster 2 services are age. Oh, that's the data. So Cluster 2 services, I apologize. Cluster 2 services are congregate nutrition, nutrition counseling, and assisted transportation. So the level of information that you need to collect for Cluster 2 services is all of the demographic information that you can see on this slide. Minus so for congregate meals, the nutrition risk, but not the activities of daily living and the instrumental activities of daily living. So the ADLs and IADLs do not need to be collected for Cluster 2 services. And you can see the level of information that needs to be collected. And I apologize for this. Does not need to be collected. I apologize, that didn't get translated there. We will make that correction prior to you receiving this. The other reason we want to make sure that you have this slide deck as a tool is we want you to be able to use this training and slide deck as a train the trainer, because maybe not everybody in your department or everybody within your agency was able to attend today. So you will have the resources to be able to be the expert and be able to talk about all of the requirements related to the data collection. Okay, so as you can see here on this slide, we have the definitions for these Cluster 2 services. Again, I'm not going to read them, but you do have access to them. So Cluster 3 services are non-registered services. So what that means is that a very minimal amount of information is required to be collected for these services, which the level of data is, so eligibility would be age and name. However, I want to clarify that for information and assistance, anybody can call. They don't have to be over the age of 60. So their name and age would need to be collected for folks receiving transportation, nutrition education, evidence-based health promotion disease prevention services, or non-evidence-based health promotion disease prevention services, and other services. I know that a lot of you provide fitness through the senior centers, and that is another service that I have seen over and over when I've reviewed the data that is submitted. So there are, later on, I'll be able to share with you some of the domains, some of the categories that those other services can go into. So let's go into real quick the definitions for non-registered services. And you all know what those are. So we're going to move on to Health promotion, disease prevention. So this is funded out of Title III-D of the Older Americans Act. So I'm going to spend a little bit more time on this one. As I see this service being so important, okay? So what I'd like to share with you is that all states that receive Older Americans Act funding under Title III are required to spend Title III-D funds on programs, evidence-based programs that have been proven to improve the health and well-being and reduce disease and injury. This has been around since 2003. The Aging Network has been steadily moving towards wider implementation of disease prevention and health promotion programs that are based on scientific evidence and are demonstrated to improve the health of older adults. In 2012, with the congressional appropriation of Title III-D, it included for the first time evidence-based requirements related to those funds, to those Title III-D funds. So in response to that congressional appropriation law, the Administration for Community Living, Administration on Aging, had to develop criteria for the evidence-based programs. So there are definitions, and there's a lot of guidance on the Administration for Community Living website that talk about how to determine if a program meets evidence-based criteria. So there are a couple different ways. So that is spelled out on the ACL website. So the program is considered evidence-based if it meets the ACL definition, and I'm not going to go into detail on what that is right now, or it can be considered evidence-based if any of the other operating divisions within the Department of Health and Human Services, so like Centers for Medicare and Medicaid Services, SAMHSA, so the Substance Abuse Mental Health Services Administration, has some evidence-based programs that could be funded. So mental health programs could be funded by Title III-D within your areas. And so, it's pretty open as long as they're evidence-based programs. These are programs that can be implemented through the Title III-D program. Okay, so the other piece on this slide is the health promotion non-evidence-based programs. So as you can see here, these are services that we used to do and use our Title III-D funds prior to 2012. Remember when you used to be able to charge Title III-D for health fairs and medication management? Well, because Congress decided that Title III-D funds have to be spent on evidence-based programs, the Administration for Community Living didn't get rid of the states, the AAAs, the providers, from being able to provide those services. You can still provide those services, but they're funded under Title III-B, so the supportive service category. And as you can see here, here is a huge list of different types of examples of those other services, of those non-evidence-based health promotion programs. Okay, so it wasn't taken away, it's just funded differently. And when you report those services, it's reported a little bit differently. All right, moving on. So here are the other definitions for the non-registered services. So we have information and assistance and other services. So I would like to share with you that, Oh, I want to remind you all that cluster 3 services, so these services require the collection of the least amount of data. So that's why they're non-registered. So it just has to be eligibility and age. And like I mentioned earlier, information assistance, that's open to anybody. All right, let's move on real quick to Title 3 and 7, state and federally funded legal assistance programs. I know that each of the area agencies on aging in New Mexico have providers that are providers of legal assistance. And so we wanted to make sure that we were inclusive of those folks too. So here is the definition of legal assistance. All right, just wanted to be able to share that with you. I'm going to now move on to one of my favorite programs, which is the Title III-E Family Caregiver Support Program. And so I want to remind you all, and we're going to get into this a little bit further into the presentation also, but we need to remember here that the clients are the caregivers are the clients here. So I want you all to think about, have you been a caregiver? Have you needed support when you're caring for maybe your mother or your spouse or your partner? Yeah, that informal caregiving is what this program is intended, that's who it's intended to help. And so, as you know, families, you and me, are the primary support for older adults and people with disabilities in the United States. Many caregivers work and also provide care, and a lot experience conflicts between those competing responsibilities. Research also indicates that caregiving also enacts a significant emotional, physical, and financial tolls on families. With nearly half of all caregivers over the age of 50, many are vulnerable to decline in their own health. Studies have also shown that coordinated support services can reduce caregiver depression, anxiety, and stress, and enable them to provide care longer to their loved ones, which helps delay or even avoid the need for costly institutional care. So, as you know, the Family Caregiver Support Program has been around for a long time. It came into being in the year 2000 with the reauthorization of the Older Americans Act. And so we'll get into the different eligibility and services associated with this. So, all right, let's move on to the next slide. All right. So the Family Caregiver Program provides caregiver support to two separate groups of individuals. So they can be caregivers of older adults or older relative caregivers, which I lovingly still call grandparents caring for grandchildren. Um, so when we think of an older relative caregiver, it was first coined as grandparents caring for grandchildren. So when you see on this slide, the eligibility for caregivers of older adults is it could be anyone over the age of 18 providing care to someone over the age of 60. Okay. And then it also delineates a little bit further, and I'll just let you read that. But an older relative caregiver is someone who is providing informal care, and it doesn't have to be a grandparent. So as long as they're not parents, aged 55 and over, providing care to children under the age of 18. This piece of the older relative caregiver program also allows older relatives, including parents age 55 and over, providing care to their adult children 18 to 59 if those children have disabilities. So this is a super cool program. It's one of my favorites. And like we talked about, these services, which we're going to get into now, really help reduce the stress that a caregiver experiences. So think back to your own personal caregiving experiences with your loved ones. It's amazingly stressful. So they're like the other Title III services, there are registered for the caregiver support program, and there's non-registered services. So you can see what these services are. The registered are counseling, training, supplemental services, case management, and respite. So the non-registered services are support groups, information assistance, and public information services. All right. And these services here are the same for both the older relative caregivers, so grandparents caring for grandchildren, and the caregivers of older adults. So I'd like to share with you the type of demographic information that is required to be collected for the caregiver. Remember, the caregiver is the client with these services. So what's collected is age, gender, geographic information, their poverty status, their ethnicity, and then also their relationship to the care recipient. So there's a big long list that I'll show in a bit. So now it's time for our first poll. And I am going to go to the next slide. You're going to be able to see the poll, and then I'll turn it over to Denise. So you should be able to see the poll. Great. I see lots of people answering. So the poll says, when completing the Universal Consumer Information Tool, you must fill out all demographic, consumer characteristic, ADL, and IADL information requirements. I'm so proud of you all for participating. This is awesome. All right, Denise, you're on mute.
It keeps clicking on. So I'm gonna go ahead and end the poll. We have 96 out of 96 responding for 100%. And we had 60% say true and 40% said false. So that is, yeah, that is false. When completing the Universal Consumer Information Tool, the question is must fill out all demographic consumer characteristics, ADLs and IADLs, which is not true. Courtney, you want to go ahead and explain?
Yep, I'm sorry, I apologize. That was a trick question that I built in there, just to be able to remind you all that remember the clusters. So we're only talking about clusters 2 and 3 today. And so cluster 2 are the services that we talked about a few minutes ago. And cluster 3 are like, transportation, information assistance, and like congregate meals. So I'm blanking on the all the clustered services. We'll get into them again. But it is false because you don't have to do all of it for every client, just depending on what service they're going to be getting. So cluster 1 services is the most intense. All right. Thank you all for participating. I really love this group. All right.
Courtney,
So, yes.
I'm going to go ahead and read one of the questions in
Oh,
the
sure.
Q&A.
Yeah.
It says, will the data center be notified when a provider is inputting data? And how will we know when consumers are being updated, input into the system? So I'm going to take it that this may be one of the AAAs asking a question about the service providers and when they're assessing seniors and if there's actually new data being input. I think that's question might be, I'm gonna maybe need clarification on that one. But I think they're asking when we get to a point where this is live, as far as the providers being able to complete the assessment in true time using a tablet, iPad, or computer by completing the assessment with the consumer. And so there will be, and that is going to be a question that we ask WellSky to see if there's a prompt that will be made maybe to the AAAs. But I think that was a good question. And it reminds us to, when we're finalizing this tool with WellSky, which will be over the next few weeks, before we actually go live with this tool in the system, in the database. So providers can print or they can do this live. So if that, yeah. And we'll be asking that question to WellSky and let you go, that in our FAQ that we release.
Yes. Great. Denise, thank you so much. All right, let's move on. Let's move on to the definitions for the caregiver program. And like I've said, we want you to be able to use this slide deck as a tool to be able to make sure that you reach everybody within your office and new staff. So for counseling, training, and supplemental services, like I shared with you, the demographic and characteristic information being collected is age, gender, geographics, poverty, ethnicity, and relationship status. For supplemental services, I don't see that I don't remember if I've ever seen a lot of supplemental services being utilized in New Mexico. I wanted to share with you that supplemental services is one of the really coolest pieces of the Title III-E program in that it allows for things that will help reduce the stress of the caregiver. Like, let's say they need some durable medical equipment or emergency response device. That can be funded under supplemental services, just like consumable supplies, home modification on a limited basis, some transportation. So this is such a cool service, supplemental services. And in the definition, you see on a limited basis. So those are decisions that the area agency has to make on what level of funding they will allow for those supplemental services. But I love it. This program is really great. So, okay. Our next definition is case management assistance. So as you can see here, and as a reminder, this service is available for both caregivers of older adults and older relative caregivers. And the same geographic or the same demographic information is collected for case management. So let's talk about respite. Okay. So I know that you have clients, you have consumers that receive respite care. Okay. On the information, the universal information tool, I totally got that wrong. It does say, does someone have a caregiver? So if someone's getting respite, you may want to really check and see if that caregiver needs help, okay? Because this Title III dollars could be used to support that caregiver, used to support that respite program. And as you can see here, respite has been delineated out and kind of chunked out more so that everybody has a better understanding of what type of respite services are being provided. Okay. For respite services, it remains the same level of information that is collected as the other caregiver services. But this is, I really want you all to explore this because this is a way where you can utilize other federal dollars, Title III dollars, to help support your respite programs. If that client, that traditional client, has a caregiver and that caregiver really could benefit from that time, I think it makes sense to be able to utilize Title III for those folks. Okay. So support groups, here is the definition, little bit of information. So non-registered services, it only requires basic eligibility criteria to be collected. And that's just age for both types of programs. And these don't require eligibility at all because it's information and assistance and public information. So when there's public and media activity, you know, these dollars, Title III dollars can be used to put information out to the communities about this important program. Okay. I'm going to ask you all a question. And I would love for you to be able to put this in the, oops, my audio is going out, sorry. And Amy had a question.
No, I was just gonna let you know your audio was going in and out.
Oh,
We're good.
no. Okay. Is it better yet?
It comes and goes, Courtney.
Oh, no. Okay. Is this better?
It was much better with the headset, Courtney. It's waffling, but, and it was only a few seconds before you actually adjusted your mic. Try it again.
Is this better yet?
Hold the mic to, yeah. Say it again.
Is this better? I'm going to turn off my camera.
Yeah, it's waffling and it might be just the pulling of the video. So yeah, if you don't mind,
Okay.
thank you.
Okay. Of course. Hopefully this is better.
Much
Please
better.
let me know.
Much
Okay,
better.
perfect.
Yes.
Okay, awesome. Okay, so now that we have that taken care of, I have a question up on the screen. So I would love to have you use the question and answer feature of the Zoom technology to answer this question. So I'm going to take just a minute, please answer the question, which is, why is it important to have consistent practices while conducting consumer assessments and reassessments? Yes, I see one answer here. if I get a couple more answers in the Q&A, I think I could let you have a little self-care break. I hope that's motivating to have a couple more folks put your answers in here. Perfect. That's awesome. Thank you so much.
Courtney, while we're waiting for a few more to respond to your question, I'm going to go ahead and just read a question and respond to a question in the chat, or I'm sorry, in the Q&A.
Perfect.
And it's saying, we had mentioned that printing the assessment in the time being until mobile assessments take place, while reviewing the assessment in the test database, I noticed that there is still discrepancies between the blank Universal Consumer Information Tool and the reassessment Universal Consumer Information Tool. Missing questions except example gender identity, which is in OAP's reporting and requirement, and mapping. Will these issues be remedied prior to the assessment being rolled out on 10/1? And the response is yes. The department is working with WellSky to complete this tool that's currently right now in the sandbox, and it will be ready prior to October 1st.
And Denise, the one thing I'd like to add about that is, Davida, thank you so much for bringing up the reassessment. We'll make sure that gets taken care of. Well, I love all of the answers. You all have been paying such good attention and have such great practices. Thank you, thank you, thank you. I really appreciate all of your responses. I think we're going to go into, I'm going to move the slide to our self-care break. So I'm going to put my timer on and we're going to give you 5 minutes to be able to get up and stretch. And thank you for whoever brought that up for this first, in the first training that we just went on and on. I really, really appreciate being told we need to take a little bit of a break. So thank you again. We will see you back here in 5 minutes. And I have the timer going, friends. All right, friends, let's get started again. I actually switched computers and I'm hoping that my audio is much better. So you got a gift of 2 more minutes than we first anticipated. I'm going to go ahead here and, oh, someone asked in the question and answer, do I need to create an account with ACL OAPS? The answer to that is no. The only people who need to have access to OAPS are the area agencies on aging and the state ALTSD. So thank you so much for that question. I am going to start sharing my slides again because I did a complete computer switch. So I really appreciate your patience with me. So I'm going to share that again. And I need to go back to slideshow. Now, is everyone seeing that okay? Can I get a thumbs up from one of my colleagues?
Courtney, you're sharing in presenter view.
It's okay. See, that's what happens. Okay. Have you ever had a year in your life where you just continue to be humbled every day? I'll share with you that is my current life. So thank you all for your patience and grace to me this afternoon. All right. Joey, is that perfect?
Yep, that's good.
now? Hey, thanks. All right, friends, let's continue on. All right, let's see where we're at. Okay.
Courtney, is
So,
this my section?
Miriam, this is your section, my dear friend. There we
Well,
go.
welcome back. We're going to be talking about the Universal Consumer Information Tool. And if you look on the right-hand side, this is what the printout from WellSky currently looks like. However, as Denise told you, we're in the process of modifying everything so that the assessment and reassessment and everything aligns. And we're working with WellSky on that. So this only shows the front page, and it will not, this is if you're printing it. This is not how it looks if you're filling it out online. And if you're filling it out online, you will have skip technology. In other words, if you're not doing the ADLs or the IADLs with the consumer, then it will skip that section for you. So we're going to go through each one of these items. And I need to mention again, the way that this was developed was we took what the federal requirements were, or ACL's requirements for us. Then we looked at the state requirements and what was an NMAC. Then we spoke with the AAAs and we went back and forth, and we've been working on this for several years. So this has not been a short process. And I know that the tool looks long, but it is shorter than some of the tools that were being used, and is longer than some brief tools. So let's go to excuse me, to the next slide, please. Okay, so this is just basic. Are you doing an initial assessment or a reassessment? And then over here, we have options of checking who you are. So are you a community provider? Any of these other items? And if you're not one of those, there's a spot for you to press other and fill in who you are. Next slide, please. The next thing we're checking is physical health. And so we're asking the consumer, since this is person-centered, how do you rate your overall health? And then we're checking, have you seen your doctor, your primary care physician in the last year? And if you'll notice, these questions were going down, not across. So it's one, and they'll be listed across on the form. Then have you fallen in the last 6 months? And then explain why if you have fallen. And have you been hospitalized in the last 6 months? So we're trying to determine how the person thinks about themselves. So what services do they believe they need? The next slide, please.
Oh, sorry. I apologize.
No problem. And then basic information. What's your first name, your middle initial, your last name, what date you registered, what's your date of birth. Now, I want to put a caution in here because there are very similar names, lots of similar names in New Mexico. So you need to make certain that you get the person's first name, their last name, and their date of birth. And you double check that there's not already an entry in WellSky. Otherwise, you're making a duplicate. And I have to tell you, when I first started working at ALTSD, we found about 1,500 duplicates in WellSky. So please use extra caution and make certain that there's not already a person with the same name and the same birth date in WellSky. Then it's what's your primary phone, what's your email address if you have one, and what's your marital status, and what's the name of your spouse or partner. Sometimes the name of the spouse or partner, if the name over here, full name, first name, middle initial, and last name are the same, the spouse or partner may give you a clue that they're already in the system. Next slide, please.
Miriam, I would like to answer a question that just came into the question and answer. So
Okay. Thank you,
someone wrote,
Courtney.
I noticed that Social Security number is missing. Recently, guidance was provided to collect the Social Security. Has this changed? The answer is yes. We are no longer collecting the Social Security number along with this other information.
It is information that someone might be able to take off of an ID card that is at the senior center, the social last 4 digits of the social with your birth date. We must collect, according to the Older Americans Act, your birth date and your name for any service. So that's the minimum. And that's what New Mexico has chosen to go with. And I think it's an extremely intelligent decision and it protects your demographic information.
Miriam, this is Denise, and if I could also mention that the consumer ID, which was made up of their last 4 digits of their social and their date of birth, that too has been changed. So they will be, when they're reassessed or any new consumer being assessed, will have a new identified system generated ID.
Precisely. It's for
And
your safety.
it's for the consumer's safety, yes. And I'm just going to go through a couple of questions while we can here. Raven has, I noticed that there are more questions compared to the current assessment form we are using. Are the additional questions implemented to get a better understanding of what the person's situation, or are they a requirement of the state?
There's a mixture, in my opinion. Some of them are required by federal government. When we get a little farther on, you'll see that it's now RUCA codes, not zip codes. We've always collected zip codes. So I'll talk a bit about that. So it's different for different entries.
And there are some questions on the information the basic information, demographic information, a sheet for each consumer that we, the state, have chosen to add questions to this assessment so that, yes, we can capture the full situation of the consumer. And for instance, with the fires, the floods, and other emergencies across the state, there is a need to determine if a consumer, one of the Title III consumers, needs immediate assistance with maybe an evacuation. And we wouldn't know that unless we gathered this information on the front end when assessing or reassessing a senior. So there are some questions for that reason. I'm going to ask a few more questions. What will the ID number be then? It's the IDs will be randomly given from the system to the consumer upon registering and re-registering. So not all IDs will be automatically done all on October 1st. Any new consumer being assessed October 1st, moving forward, will have a generated ID number from the system. And then upon their reassessment, they will then be given a generated system ID number. Is the date registered the date of the initial registration, or is it the date of the reassessment? It's the date of one or the other. And then you stated that there are 1,500 duplications. What if a person was relocated from one county to another? And that needs to be determined upon interviewing them and vetting them, is to determine if they're in the system already based off of their date of birth and their name, and if they've moved from a location before. You can ask that before determining if they're a new consumer. So there's several questions here, Miriam. I can let them stack up or take this time to answer.
Let's go ahead and answer them.
Okay, I understand that the assessment's moving to an annual instead of a semi-annual. Is that true? That is true. In NMAC, it's very clear that it's on an annual basis unless the circumstance with the consumer has changed, that it requires you to reassess them sooner than the annual schedule.
Denise, can I just
Yes, please.
Okay, for instance, let's say someone has had a stroke. Then that person needs to be reassessed. So a life-changing event, you need to do a reassessment for. The next question.
I would like to follow along as you review how to fill out the assessment. However, I'm not sure which assessment tool to choose for a senior center. Please advise.
If you're looking at any tool in the sandbox, you're not going to be able to follow it accurately because it has not been totally aligned by WellSky. That is why we pulled the sections out and we put it on this PowerPoint so you can see the questions.
We will, however, be providing a sample of the assessment during upcoming sessions. We do have working sessions with WellSky to address all the updates, and we hope to have that soon for the upcoming sessions. There's another question.
Another question.
Yeah, when this is live and providers are entering data, will they go through, will they have to go through all the consumers with the same name to make sure they aren't entering a duplicate, especially if some consumers receive services from different sites?
You'll have to check, yes, but there should be a faster way to check than just looking through everybody's name. So we need to determine that. That's something I'll put on our list to do. And we'll give you a way to do that, the most efficient way, in one of our next meetings.
One more question from Lauren Chacon. We are already doing a number of merges for duplicate consumers as is. How can you ensure that this won't keep happening with a random generated ID number that will create more work for providers as well as staff?
I'm not, what you're saying is you're doing a search like on the last four of the ID number. Is that what you're saying?
I think Ms. Chacon said is that they're doing merges now to clean up their system to see that the duplicates are merged. And how
And
will
that's
that be
perfect.
ensured if the system is generating a number? We've been assured by WellSky that they will not be a duplicate generated number for the consumers.
No, there'll be individual consumer numbers, and it won't be, you wouldn't have any duplicate numbers. You might, if you entered a consumer twice with the same name, the same age, the same birth date, the same spouse, and you didn't check before entering that, that might create a duplicate. Any other questions, Denise?
Not at this time.
Okay, next slide, please. Okay, this is a very important slide as far as I'm concerned. What is your primary language? In New Mexico, we have many different languages where people are speaking something other than English, and it is not necessarily a written language. So it's important that when we're gathering this information, someone is there who can really interpret what the older adult is or disabled adult is telling you, and you're not misinterpreting it. And then this next section, this part of this is New Mexico governor requirement for SOGI, and part of it is ACL. So number 11, that's ACL. And the number 12 has the items that we need to know for the state. Next slide, please. Again, these questions are required. If you just read them down, they're required by ACL. These are the minimum requirements by ACL. And they are requiring number 15 I want to talk about. This is going to be a challenging question for some people to answer if they're in the poverty level or not. The guidelines, the poverty guidelines by the federal government are shown on this link, and you have to read the link carefully to help them determine if they are, or they may choose not to answer the question. But again, if any of these questions that don't get answered roll up into OAPS, which is our reporting system to the government, and we get the percentage of error for as many questions as we don't get answered. So it's extremely important. When we started, I think about 4 years ago, we have people who have been very conscious about this and conscientious. And we've gone from like 42% missing data down to 0. So for both Metro and non-Metro, I truly appreciate your efforts in this area. I think the next two are self-explanatory. If what's your veteran status and do you live alone? Yeah. The next question is, do you have permanent housing? Now here, this may seem like a duplicate question. It is not. 19 through 19E, this is the way that we answered prior to this year, about, or prior to OFs, about where you lived. We always did it by zip code. Now they're requiring the RUCA code. What is the RUCA code? It is based on the census tracts. So it gives us a more specific location than zip codes do. And that is now required by ACL. And it looks like we've got what is the zip code twice and what is the state twice. So we need to make certain that we double check that. And then we have emergency contacts. Okay, let's go on to the next slide. This is an important slide because when you're determining what services a specific consumer needs, you want to know what benefits they already have. If they're already getting SNAP benefits or they already have Social Security disability, you don't want to send them to Social Security disability to get that benefit again. And so this is our list of services that are potentially available. And here's our health insurance question. Do you have health insurance? Yes or no? If so, what do you have? I think that's self-explanatory. And this is what Denise was talking about. Our emergency preparedness questions. It's really important when there's an emergency to know where people are and what they need in order to be assisted. In the fires down south with the cold weather at points, we need to know where the people are who have like chore benefits of someone coming and helping chopping wood. We need to know where they're located, what they need. And I'm going to let you just read the rest of these. What is your main source of heat or energy does your home use, so that we know what's going on with you? And we ask about clean water. So the basic services that you need, we're trying to find out so that if you are without something or need help, we'll be able to support you in providing that service. The next slide, please.
Okay, Miriam, I'm going to go ahead and implement the actual, let's see if I'm able to do this because it's not giving me that option. Hold on one second. Let's see. Yep, we've implemented the poll question. So if you would please take part in that poll question listed on your screen.
Oh.
As we give that a minute or two, I'm going to go ahead and go through some of these questions that were listed in the Q&A. Do these questions directly correlate to the specific section in WellSky? If not, where will they be recorded? Miriam, are you still there? And I'll go ahead and answer that, although the question went off the screen already. Yes, it's correlated to this in the system and is specific on the live assessment as well as the printed form. It will also allow for us to filter some of this information that's collected. For instance, there was 3 years ago a issue up north where seniors that were on propane there was a vendor that went out of business and was not filling propane tanks in that area. It required the state to move swiftly to get, and it, because of regulations, it required multi-agency responses to a situation. And we could have filtered the information of what consumers relied on propane if we had collected that information. And that's why some of this information is very important. We have to remember many of our older adults live in rural areas of the state, and that's why it is important to collect the RUCA codes as well as the zip codes, so that if we're asked by emergency management, by Homeland Security, of who our vulnerable population seniors are in an area where there's an emergency, we can filter our consumer data to be able to locate seniors and respond quickly to a situation. Where does the RUCA code come from? That is through the federal government, through the Census Bureau, that RUCA codes are now being used. I think I answered Julie's question as well. In the sandbox, WellSky has questions answered by default rather than input. It is then difficult to see if the question was skipped or if consumer answered with a default answer. Is this being addressed? Thanks, Kyle, for your question. And I believe you've made that point previously, and that is being addressed with WellSky. And I'll ask Miriam and Courtney to take note of that so that we're bringing that up once again with WellSky. Live assessments, yes, live assessments. You will have, if the AAAs implement policies and procedures around live assessments, that can be captured using a iPad, a notebook to be able to do those and have that data in real time. Can a link be added so that we can quickly get them? Julie, I think we'll take that one offline. And let's go
Denise,
back
this
to
is-
the poll, Courtney.
Denise, this is Courtney. I made a note of that one because we did put a poverty link on that poverty question. I think it's a great idea. We could bring that up with WellSky. So
Courtney,
the poll I'm sorry, go ahead.
no, go ahead. I was just asking you on the poll question.
Yep. So the poll questions, we had 2 of them, and I think for this being the second training, the majority of folks, 65%, felt that they had a really good understanding of the demographic data that needs to be collected, and 66% felt that they have a really good, solid understanding of the consumer characteristic data to be collected. So I'm really happy that we're doing these trainings. So I appreciate everyone for doing these polls. Thank you so much. All right. I think we're going to now move on to, we're going to now talk about the caregiver information. So Miriam, are you good to do the caregiver information, or I'm happy to do that?
I'm going to let you finish. I
Okay.
apologize.
Oh, no, you're good. Yep. Okay. All right, friends, we are now looking at the caregiver information that needs to be collected on all caregivers. So as you can see here on this slide, does the consumer have a primary caregiver? Yes. So this is something that will need to be completed. So if yes, these are the questions that they need to answer. I talked a few minutes ago about the level of information that needs to be collected. So it is actually pretty minimal here. So as you can see, the name, the date of birth, the phone number, and the relationship to the care recipient. Okay. So it's actually really pretty simple. One thing I also wanted to mention to you is that collecting this caregiver information is actually within the Older Americans Act. So in the 2020 reauthorization, um, Congress decided that we needed to do a better job of doing an assessment on caregivers. So this is what we have at this point to be able to do that. So we are going to move on to the nutrition health assessment. Now, Denise, I know that we talked about you doing this. If you want to do this, go ahead. Or I can do it.
Well, I have to take myself on mute. Yep, I'll go ahead and take this
Awesome.
section. Of course, nutritional health assessment in the assessment tool is an important section to really look at with each consumer. The nutritional services is one of the highest service accessed statewide for congregate and nutrition and home delivered meals, as well as the implementation of grab and go as we go back to that in case of a situation that requires a specific consumer needing a grab and go meal, meaning that for a specific reason that you're able to justify why that consumer needs a grab and go. There may be mental health issues, behavioral health issues. There may be a number of things that you as the provider have identified of why a grab and go would be needed. And so that's why this section of the nutrition the nutrition assessment is important to really address. These questions have not changed on the assessment tool. But it is important that you're really capturing this information from the consumer themselves. I know many times consumers may minimize some of this information being asked. It's important to engage them in this assessment, to gather this information as part of our reporting, the state's reporting, which means information from the AAAs and the direct service providers. We have to report to the Legislative Finance Committee on a regular basis on seniors scoring above a 6. Now, we know we also cross-reference information with Healthcare Authority, or what used to be HSD, for those accessing SNAP or accessing the food box programs like ECHO and others. So there are ways that we're cross-referencing some of the data to see that consumers that are scoring high are also benefiting from some of those other services. So it's you as direct service providers and your staff that are making that connection for the older adult that you're assessing as being at risk or in high need, scoring 6 or above. Okay, I'm not going to go through all of the questions. Obviously, these are the same questions that are in the current assessment. So if you would go ahead and advance the slide, Courtney.
And I do have to point out that this is the incorrect version of the slide deck that I have this on. So here are the other questions.
When asking these questions, as I said, please engage the consumer. It's important for us all, you as direct service provider and us here at the state, to know if, do they have enough money to purchase the food that they're in need of? Do they eat alone most of the time? I mean, these are the standard questions. I also want to make mention that SNAP HSD, or Healthcare Authority, as of July 1st, Healthcare Authority increased the SNAP benefits to our older adults, which was a huge lift, because that many of our older adults were getting $29 a month, or at maybe $41 a month, as we've all seen the food costs go up. You as service providers know that best, with the cost of the food having gone up. It's important that we're able to connect the older adults to where they can get the application or assistance in completing the application for SNAP benefits. But the increase to SNAP has gone up for older adults as well. And I'm going to go ahead and ask that you advance the slide.
All right, so we're gonna have oh, this is Denise again. But we're,
Yeah,
go ahead.
I kind of went through that in going through those last two slides. What does a high nutritional score mean? And that is that our older adult is at risk. And we know that those at risk, it doesn't always mean malnutrition. But it is important that we're connecting our consumers with where they need to access additional benefits. The meals, congregant, home delivered meals, and grab and go are a huge service to our older adult population statewide. We know how important it is. I've already said that it is the largest service accessed, Title III service accessed. So it is important, but we also know this is one meal out of the day that they receive. And we all know that some of those that are at high risk eat off of that meal, those that are homebound, 2 times a day. And you've heard me say this before, that some of those older adults also share that meal with their 4-legged friend, their housemate. So it's important that those that are nutritionally at risk are also referred to other community-based services so that they can access the nutritional need that they are faced with. So you're the ones that see them. You're the ones that have them accessing that lunch meal from you. Many service providers have entered into their contract with the AAA to provide a few programs, only statewide, do breakfast. A few providers do evening meals on occasion. And most providers do weekend meals if the senior is scoring high. So if you have a senior scoring above a 6, you have then being able to justify the weekend meals that are needed for the consumer. Courtney?
All right. And there are a couple other questions in the Q&A. We will get to those. So thank you so much. Denise, thank you. I appreciate you. All right. So we are at the time of our training that we're gonna work through a scenario as a group where I'm gonna it's gonna be on the screen, but I'm also gonna read the scenario to you. And you're going to have to think about what services that this person is in need of. Okay. So let's get started. All right. So this is our experiential learning. Our new client's background is that the client is 61 years old and has suffered a left brain stroke approximately 6 months ago. They have recovered from the stroke quite well in terms of lower extremity function The person can walk independently, although they are still weak and have occasional lapses in balance. However, their left hand is paralyzed. The client is married, but their spouse is an airline pilot who travels considerably. So the client has recently moved into an apartment near their daughter who lives in Albuquerque. The client can do many daily tasks independently, but struggles with being able to prepare simple, healthy meals. The daughter checks on her parent a couple times per day through text messages and phone calls as she works full time and has a busy family. The client goes to physical therapy twice a week, and the daughter can only take the parent once a week. While the client is doing well with walking and physical function, they are extra cautious after the stroke as they still have some moderate balance problems. The client would like to find assistance to add some equipment to their new apartment, such as grab bars in the bathroom, a rail by the door. They're also curious if there are other services available. So, what I would like to talk with you about real quick is that what you're assessing for are cluster 2 and 3 services and the possibility of caregiver services. So I'm going to switch the screen so you can look at the different service recommendations. All right. So this is directly from the Universal Consumer Information Tool for the cluster 2 and 3 services, as well as caregiver. So in the question and answer, let's have a discussion. I wish the chat was working. Let's have a discussion about what we think would be best for this client, for this consumer.
And for this section, Courtney, they can put in some comments in that Q&A section,
Yes.
just so we make that interactive as possible, as much as possible. And while they're doing that, I'm going to keep the Q&A open. We will get to, there's 3 Q&As or questions in the Q&A that we will address. But at this point, as Courtney moves forward through this scenario, we're asking that you list your responses in Q&A.
So you've looked at these. I'm going to put it back on the scenario at this point and just let you all just take a look at that again. All right, we have some answers coming in. So I'm going to switch back over to the service recommendations again. So caregiver, assisted transportation, those are great recommendations. Benefit from home delivered meals, nutrition education, transportation, in-home respite. Yeah, home delivered isn't an option on this one. But I love that question because, Raven, if home delivered was an option where if you come to our next training, which we sure hope you do, we're going to get into the cluster 1 services.
If you're having to do a nutrition program like home delivered or congregate nutrition, what which what else do you have to do for that? Even if this person was able to maybe have transportation, regular transportation to a senior center for a congregate meal, what other assessment would you have to do?
Assessment or service are you talking
Well,
about?
assessment. I'm talking nutrition screening. I was being tricky here. So again, here's the nutritional health assessment, and I did get the one corrected on this one. So there's the nutrition assessment. So if that person needed congregate or home delivered meals, right? Maria, I love your answer of repair home modification. So let's say that this client got, so this is the client, and let's say that she says, yeah, I do have a caregiver. My daughter is helping me a lot. That home repair, that repair home modification could also be through the caregiver program for under Title 3D, which is, or under Title 3E, which is for the caregiver program. That home repair modifications can be done, excuse me, under supplemental services. Yes, I love this. Yep, respite care would be great too, right? And you know what's great too is this person in this scenario, you know, she does have support, but even though this person has support, the services that are offered through the programs that you all administer really make a difference in people's lives. Yes.
Great responses in the Q&A. Clearly, many are indicating cluster 1 service of home delivered, Courtney.
Yes.
They're also clearly identifying the cluster 2 and cluster 3 services. So great responses, and
Absolutely.
you know that this is not always easy, because as you're interviewing, and it does require you to meet with seniors one-on-one and not being given the assessment for a senior to take home and fill out, because I just heard about that happening last month. So that is not an okay thing to do. This is a one-on-one assessment with the consumer, and you gather more information. This was just a scenario that to get you thinking, and you're the experts. You do this already. We also know that many of you logged on today are new to the network, and we welcome you. And we also know that many of you, even seasoned administrators or directors or managers, have new staff that you have to train. So in no way is this going to be a final training. We definitely know that there's going to be a need for technical assistance during this time. The reason for the universal consumer information tool is so that it's standardized and that we're getting all providers using the same tool. But we know that as you're interviewing seniors to gather this information, that you will also have more information, background information on this senior. And we are approaching, about 13 minutes till the end of our session. So I'm just going to go through these questions, if you don't mind, Courtney, just quickly.
One
Um,
thing real
the-
quick.
I
Go ahead.
apologize for interrupting. I meant to type this question, but I pushed the wrong button on Lauren's um, question. It was she's not seeing the information in the chat. The chat is disabled for this meeting. It was just through the Q&As. Okay, go ahead,
They're set
Miriam.
up as a webinar. It's
Denise,
the
yeah.
chat is really through the panelist, so we apologize, but the Q&A serves as that purpose for some basic information in response to the Q&A or the polls. It's hard for chats, especially during last session with Teams, because it caused some disruption for the interpreters or for those that the participants. So we wanted to eliminate or minimize that. So there were a few questions. Davida has here, this is speaking in the interim until mobile assessments are live in order for providers to conduct reassessments in a pre-filled data format using the Universal Consumer Information Tool. Consumers have to have previous Universal Consumer Information Tool entered, as some of these questions are just being asked for the first time. To alleviate the stress of the transition for everyone involved, may I ask that options be explored to make this as an easy transition? In addition, will these questions that are only being captured on the assessment form pre-populate to the next assessment for providers' convenience when this goes live? Or will assessors have to re-enter this information each time as they would if the consumer were new? They have to verify the information update. And so that means some of that information that would have previously in this previous system, Davida, populated over, some of that we're finding was outdated because providers are not reevaluating that information before, during a reassessment, before they submit it. For instance, we had seniors that needed to be evacuated in Ruidoso, and phone numbers were not current. So if the providers are not verifying some of the basic information, it causes then issues. There were a few other questions. I know that Virginia down in Harding asked, are grab and goes coming back? And that's for the AAAs to really assess with each provider, dependent on the circumstance. It's not a flat grab and go service unless there's deemed an urgency for it. There is a flooding going on in San Miguel, and the senior center was flooded. So they approved for the provider to do grab and goes from a safe location outside of the senior center. So clearly in situations like that, grab and goes are approved. With consumers that would benefit from a grab and go versus the congregant lunch, that is a determination that needs to have the consumer, you have to put in justification of why you're deeming that consumer needing a grab and go versus congregant. And there were changes by ACL for grab and go. There's only a percentage that's allowed under Title 3E that will be allowed for grab and go. And so that is very limited. And so the AAAs will have to really evaluate the situation as it's presented. The other thing I want to point out with grab and go, under the pandemic, grab and goes were considered home delivered C2. That is not the case moving forward. It is a C1 service. Miriam, Courtney, anything more to add there?
Yeah, this is Courtney. The other thing too is for grab and go. So during the time of COVID, you were allowed to move funds and, use different funding for the grab and go. However, for grab and go going forward, you cannot use Title 3D funding for anything other than Title 3D. So you have to stick within those funding requirements. All right. Okay. I think that was it on there. Thank you all for your amazing participation. I teach classes online, and I have to say that you are the most participatory group I've ever had in my whole life, and I appreciate you all so much. So we're going to be ending here just right on time. One of the things that we wanted to be able to share with you again is the Universal Consumer Information Tool implementation timeline. So we did the first training on August 7th, and that was this training here. We did a little practice with the tool today. Our next training is going to be in September, and we're also having a live session in September. And we're going to have more opportunity to be able to do that practice in September. We're also holding office hours in September, so we'll be able to answer questions. And then, as it's been shared, the implementation of the Universal Consumer Information Tool is going to happen in October. So we have one more poll, and this poll is, I've learned new things today. This is great. So we have 78% of folks that have responded so far. And the very, very 96% of folks have learned something new today, which is fabulous. We love to hear that. So thank you so much for participating and being open to learn new things. I closed that poll, Denise. And let's just move on to what I've already discussed so we are able to get out of here on time. One thing I want you all to know, and please take note of, the next training is also going to be on Zoom. Okay. So please, let's stick with the Zoom platform. I like it so much better. So the next training, September 10th, will be on Zoom. It'll be virtual. It will again be from 1 to 3. Then there's going to be virtual office hours on September. Let me move over this way. There's going to be in-person training in Santa Fe. And I am so excited. I'm going to be able to join you all for that. So we should have a super fun time. And I know when the initial flyer went out, there was a registration link to that. So please make sure that you are that you've registered for that event. And we're doing 2 different sessions. We're doing a session in the morning and then a session in the afternoon on September 18th. On September 24th, we're going to be doing virtual office hours, and That will be pretty informal. We'll just be able to have a conversation and be able to chat about, questions you may have. So at this point, I'm
If
going to
I-
turn it back over to
Yeah,
Denise.
Hi, Courtney. Thank you so much. And thank you, Miriam, for being able to log on for today while on travel. So thank you. I wanted to make mention that the space limited to 140 attendees per session on the 18th. We will have a registration that we will submit during our next session for that September 18th date for the in-person. So just as a reminder, it will be capped at 140 and for each session. We will take also an opportunity during each session to spend at least 45 minutes of that in-person time to get providers' input on services as we prepare for our state plan submission to ACL, to the Administration for Community Living. Next year, we have to submit that in June. And prior to that, we send it to the governor's office in March. And we send it to our regional office, ACL office, for a review in February. So there's a lot of timelines that we will have to meet to include public hearings in January. And it'll be right around the time when we're preparing for the legislative session. So lots of things coming up. And I will want to spend at least 45 minutes during that in-person training to get some input from providers on the services, on senior services. So I want to thank you for taking part in the second session of our Universal Consumer Information Tool training, and we will see you on September 10th.
Yes, thank you all so much. Have a great afternoon.